Sometimes people don't seem to think that the mouth is a part of the rest of the body, and they think it's kind of isolated, and what happens there doesn't have any effect on anything else.
Did you know that our oral health offers clues about our overall health, or that problems in your mouth can affect the rest of your body? Today, we visit with Dr. Len Litkowski, a dentist and international lecturer who shares education about the connection between our oral health and overall health.
The mouth can really be considered almost a window to what's happening in the rest of your body. You see generalized inflammation in the mouth, and you have generalized inflammation in the rest of the body. You have infections in the mouth that will cause an inflammatory response in the rest of the body as well as specifically in the mouth. There was a recent study that reviewed some of the issues relative to oral health and overall health and found an association of over 50 disease states that have a relationship with the health of the mouth, but specifically for periodontal disease and decay caries rates.
Robust evidence shows the association of periodontal diseases with systemic diseases, such as cardiovascular disease.
And a strong association between periodontal disease and cardiovascular disease seems to be related to inflammation that's both caused by what's going on in the mouth and inflammation that's in the rest of the body. Periodontal treatment saw an overall reduction in something called a C-reactive protein. So this C-reactive protein is an indicator of the level of inflammation. By periodontal treatment, reduction in periodontal disease, saw a reduction in the C-reactive protein. Another one is periodontal disease and diabetes. Diabetes has a level of inflammation, a chronic level of inflammation in the body. And again, periodontal treatment has been noted that it also will show a reduction in a marker that is commonly used for diabetic patients, which is called hemoglobin A1C.
7 out of 10 Canadians will develop gum disease at some time in their lives. It's the most common dental problem, and it can progress quite painlessly until you have a real problem. But there are some warning signs, including sensitive teeth.
Over 60% of the Canadian population will experience some semblance of tooth hypersensitivity at some time, and it can really significantly alter your oral care. What causes it is some gingival recession or gum recession over time, where you start seeing root surfaces that are exposed, and those root surfaces can become highly sensitive. And the concern is that it really can affect the overall health because you start to avoid areas where you see the sensitivity, the hypersensitivity is present. You don't brush those areas as well. You don't keep those areas as clean. And as a result, then you start getting an increase in periodontal disease, an increase in decay rate. It's one of those things that people overlook sometimes because it's not an infection and it's not debilitating, but it's enough to cause avoidance, which may lead to some of these other areas.
What can we do about sensitive teeth?
And they can usually be treated with sensitive toothpaste or other rinses that will reduce the sensitivity, usually over-the-counter type. But if it's something that becomes a chronic problem, something that every time you breathe in and every time you drink a glass of orange juice, you get this, then it's probably something that needs to be treated by a dental health care professional.
You have the best chance for successful treatment when you also adopt a daily routine of good oral care, manage health conditions that may impact dental health, and stop tobacco use.
But either way, it usually requires that the patient use the toothpaste on a regular basis and for an extended period of time. But also ensuring that we're taking good care of our teeth by making sure that the bacteria in our mouth is removed on a regular basis and there's not that bacterial biofilm also will help reduce sensitivity.
What does regular brushing mean?
Well, regular is actually twice a day for 2 minutes a day. It actually is a long time, and there's now more power toothbrushes that are available that actually have a timer associated with them so the person knows how long they've been brushing.
While we once believed the worst outcome of gum disease was tooth loss, we now know that oral health matters from head to toe. Dr. Litkowski shares a final message.
Oral health is integral to general health. Specifically, you cannot be healthy without oral health. And I think that's the piece that we want to leave with today. You cannot be healthy without oral health. Thank you very much.
For concerns regarding oral health, gum disease, and tooth sensitivity, please speak with your healthcare professional.